The clinical trial process allows us to safely learn about new medications and how they work in the human body. So every time you open your medication and you see the patient information leaflet, all of that information has come from clinical trials. All medications we use today have gone through a clinical trial process. So every time you've gone to a pharmacy to get a script filled or taken some Panadol from the supermarket, all of these drugs needed to go through a trial process.
Without them, where do we go? How do we harness new medicines? How do we improve existing ones? So without medical trials, it's hard to know where we go with modern medicine.
Medical trials are very important in terms of making sure that before a drug enters the market, that we've tested it both for safety and also for efficacy. And we also test for the dose level.
Since the year 2000, there have been over 23,000 clinical trials registered in Australia.
At Nucleus Network, we concentrate on phase 1 trials, so they're the first in human trials.
We're looking for healthy volunteers and in some cases, patients with very specific conditions.
Generally speaking, age, health of the participant as well, and the sex and the type of injury or the type of drug that's being trialled is important as well.
Eligibility for clinical trials is trial specific, so every protocol will have a list of inclusion and exclusion criteria, and when you come for your visit with the doctor, they will go through this criteria to determine if you're eligible.
We don't want to put people at particular risk on a trial for a new drug.
So Phil, once the trial's off the ground, so to speak, how is it structured?
So there's several different types of trials. One's called the SAD, or the single ascending dose, and the other's called the MAD, or the multiple ascending dose, where there's multiple doses. In the single dosing, what we do is we have 2 participants that come in first off, and we check that their safety is fine. So we'll have one on an active drug and one on a placebo drug. The placebo drug looks like the active drug, but it's not effective. And then if everything's fine, we'll go on and dose the rest of the participants a day or 2 later.
And just elaborate on that, once the trial's underway, how is participant safety ensured?
Once the trial's underway, we monitor participants very closely. So particularly on the day of dosing, they'll have numerous blood tests, monitoring, ECG or heart tracings, and then they'll often stay in the ward for a couple of days afterwards with a lot of monitoring. Then following that, there'll be numerous outpatient visits depending upon the trial.
All participants are compensated for their involvement in clinical trials. Informed consent is a really important part of the clinical trial process and allows participants to fully understand what is involved. When the participant comes to their screening appointment with the doctor, they will then go through the informed consent process. This is more than just signing a form. The doctor will talk about the purpose of the trial and what the trial is used for, and how the drug works in the human body.
We're very grateful when participants join our trials. Participants are aware of what goes on in clinical trials and how much they are helping to advance medical knowledge and also advance drugs to the community, which might help their loved ones down the track.
Well, first it was actually recommended to me by my cousin, and he said, you're into science, you really like this sort of stuff, I think this would be really good for you. I've done 4 clinical trials so far and each one of them have been really good.
Initially, when I found out about the trial, was from a few friends that motivated me to come to the trial. You're not really put through a lot of stress when it comes to the whole procedure. And most of the time you can just chill.
If you like reading or writing, you've just got time to do that. And it's the same with socialising as well. You meet so many people here and it's great.
So I love playing pool. It makes it really fun.
Now, the other part of it, aside from all that, is this is essentially a bonus health checkup for people, isn't it?
That's right. Quite often all of the results are normal when people come for their screening, but we do detect some diseases that are asymptomatic. Common ones that we would find are people that have diabetes and don't know about it. Sometimes we detect abnormal heart conditions, and we've even had a case where we've detected pancreatic cancer.
At Nucleus, we'll make sure we take great care of participants.
Being able to help people, that's the main purpose of it.